All right, folks. Welcome to Coffee Chats. We're going to let folks continue to trickle in, but we want to savor every moment of conversation and question and answer that we can have here. So let's start. First and foremost, my name is Gary Clark, President CEO of Economic Alliance Snohomish County. And I want to raise my coffee cup up as we always do. Those of you who have them, yes, I see. In solidarity, we're going to have a great conversation today. We are in a space of opportunity to converse, educate ourselves on getting back to normal and beating COVID. But before we dive into that, as always, I like to do some housekeeping. So for sure, we would love for you all to engage us on this conversation. Please join us via chat if you have questions. And if there's a poignant moment of time where someone can join our feed to ask a direct question or to make a formalized comment, Katie will be in the wings, waiting in the wings to help us do that as well. Additionally, if you have your organization name, if you can attach that to the chat so that we are able to know who you are and who you're speaking from, that would be helpful. All right, folks, so we know where we are today, and this conversation is solely focused on our hopes to beat COVID. And as I would say, our slogan recently has shifted to kind of a get back to business. And we know that business has been operating throughout these last 2 years, but our real goal is to make sure that we get back to some sense of normalcy. And what you see here is a brief overview, courtesy of our folks at the healthcare department as well. You can see where our vaccination rates are. Those folks eligible in Snohomish County, those residents who are fully vaccinated is at 62%. And we see the eligible Snohomish County residents who are partially vaccinated, you can see is 6%. And then as we look below, eligible Snohomish County residents who have initiated it, who have simply initiated it is 68%. I know our goal here at Snohomish County, and when we think about EASC, Economic Alliance Snohomish County, we were lucky enough to get our full team to vaccinate. And so we're at a 100%. And our goal today is to have an amazing conversation about why it's important for us to support our businesses, small and large, in this capacity. The impact has been across the board, as you'll hear from our two guest speakers. But first and foremost, for EASC, our focus has always been on highlighting and supporting our local businesses in this county. And COVID has made it difficult for our small businesses and large businesses. When we talk about the impact of those folks who have struggled with the vaccination process, but also who have struggled to see their businesses open back up in the same way that they want them to. And for us, it's really important as a community to want to get back to a place where maybe we don't have to mask again when we go in to eat at our favorite restaurant, or maybe we don't have to order out instead of going in, and just to sit down and have the luxury of sitting there without thinking about, hey, I had to pass out my vaccination card to get in here. And so how do we get back to that place? And I believe, in my opinion, and Economic Alliance Snohomish County's opinion, is that following that process of getting vaccinated, moving that percentage rate up as high as we can, as close as we can to 100% is our goal. So with that in mind, I've set the stage a little bit here. I'd like to welcome our guest speakers as well. And we have the opportunity here to talk to some candidates, actually panelists who possibly, I believe we have all three on right now. So I'm gonna go ahead and do the quick intro, and I'll allow them to each introduce themselves a little deeper as they can. So we have Premera Blue Cross, and Mr. Bill Akers is here. He is actually the Senior Vice President there. So Bill, I wanna thank you for joining us. Additionally, we have Ruth Clark, We are not related, but we probably have some like-minded folks within the Clark dynasty. Ruth comes to us as Cobalt's human resources director. And so, Ruth, I appreciate you joining us. And then additionally, we have Jeffrey Mitchell, Senior Vice President of Banner Bank. And Jeffrey, really excited to hear your thoughts as well. We'll start off with Bill. Bill, just kind of give us a little bit more of your bio and then dive into some of your thoughts here initially.
Okay, thanks, Gary. As Gary said, I'm the Senior Vice President for Sales and Marketing at Premera here in Montlake Terrace. So not that far away, and a Snohomish County resident myself, and the company is too. So I'm happy to share all sorts of information that you may want to talk about. We can talk about it from the healthcare perspective, the healthcare access perspective. I know there's a lot of conversations going on around, diversion of care and ICU capacity and those sorts of things, which if people are interested, I can share some perspectives around that. I will start by saying that that Premera is a 3,000 employee employer in Snohomish County. And I think like all of you, we're going through the same thing as an employer, right? We're having to make decisions about returning to work and hybrid versus telecommute versus on-site workers and how we do all that safely. And that has been such a fluid situation. I can tell you, March 9th of 2020, we made a decision in about 48 hours at the executive leadership team that we needed to go home. And so we sent people home. That was, I think, on a Thursday or so, something like that. We made the decision. We told people on Friday, beginning Monday, we became a virtual company, which was scary because even, about a third of our workforce was already virtual, but going 100% virtual and just wondering what was going to happen on Monday morning when the phone started ringing was a scary thing for us, which we were able to get through. We told our folks at that time, count on being out of the office 2 weeks. We are now pushed back to 12/31, no sooner than. There are a number of people, myself included, I actually am in the office today, that are hybrid and can come in. And so we're going through that process, right? Just like you all. And even for us, we had set a date of returning on July 1st. And then by the middle of August, we had to adjust again. And we anticipate we may have to adjust yet again. So one of the things Gary, Jeffrey, and Katie and I were talking about before the session is just the fluid nature of this situation. And of course, that's difficult on everybody. It's certainly difficult on workers and their families, thinking about people that have kids that they're trying to take care of and they're trying to do their job and be a teacher at home. And gosh, my hat is off to everybody that has been there for that, because I can't imagine doing that myself. And, I think Gary's point, I would underscore, to the degree that we can raise up the vaccination levels, that makes some of these other pressures a little bit easier. And so that's one of the things that we're certainly in favor of. So happy to be here today and happy to contribute as both an employer and as someone in the healthcare space.
Thank you, Bill. Jeffrey, I'm going to have you join in. I think we're still waiting for Ruth to possibly join us. So you get the mantle.
Thank you. Good morning, everybody. Thanks for having me, Gary and EASC. It's always a pleasure to be with you guys. I'm Jeff Mitchell. I work with Banner Bank. I'm in charge of commercial lending group in Snohomish County. I've been with Banner about 11 years. Physically, our offices are in downtown Everett, just near Everett High School, but broadcasting today from my house. And just a little bit about Banner Bank and what I can add some perspective on. We have about 2,000 employees spread over 4 states. So that's Washington, Oregon, California, and Idaho. So you can imagine with all the various rules, mandates, regulations, it's been hard on our HR team, I know, in getting guidance out to everybody. But just a couple things that we're doing, and I'm sort of in the old guard where, if you didn't feel quite well, you still went into work, right? As long as you could stand up. And now that, definitely we're changing the mindset from the top down. And we fill out a monthly attestation that says, hey, if we're sick, you have any symptoms, we're staying home to work from home. And so that's been something I think that we've really accomplished well. So if I think I have a cold, I'm still going to stay home just to be safe on that. Just a couple notes that I took. We are the office facing folks. We did go to a work from home similar to Premera if you were in a back office situation. Obviously running bank branches, and we have nearly 200. People want banking services and need that. So we've had in place mask requirements for our employees. We've had all the social distancing and some shields put up, et cetera. And basically just, doing the best we can to stay open. There's been times when some offices have had to close due to staffing issues. And we just, you don't want to infect any one person because it could quickly spread. And, back in March of 2020, I was one of the first that got COVID in our organization. And thankfully, it was a long recovery, about a month, but I stayed out of the hospital. So what I'm talking about is just really, I speak from my heart on this. Also, we strongly encourage vaccinations, not required at this point, but I'm vaxxed, and my coworkers I know are vaxxed as well in our Everett location. Also, the other thing that is sort of an interesting perspective is dealing with businesses. We're on the phone constantly. We do a lot of Zoom meetings, Microsoft Teams. We were back meeting with clients face to face. And then when the Delta variant came out, we decided to curtail a little bit. We'd ask the client, hey, are you comfortable meeting and going to lunch? We did a little bit of that, but then we backed off. All of our travel between, overnight travel has to be authorized in advance. So we're really trying to limit the amount of exposure that we make. And, we want our retail folks to be operational there for our clients. So we're trying to stay out of the office on the back end. Interesting, some of my clients, they require their employees to be 100% vaccinated. And the reason they told me is, hey, we go out to client sites and do our service. We meet with customers. We need to be 100% vaxxed just to take every precaution that we can. Then there's other ones that, aren't on that spectrum, restaurant group clients. But there is a big impact, a lot of our clients and workforce and, COVID illness spreading, they're not able to operate at full capacity, and that's important for small business to be able to do that. So anything I could offer, I'm happy to. It's been quite a ride. And I think one of my clients said it best is that, as the ups and downs of COVID go, yeah, we're dealing with Delta variant right now. And, there's probably going to be another one, which I heard was announced, and probably another one and another one. We have to figure out ways to stay operational and open through all this. I think we all agree we cannot shut things down. It's just, we're going to see a lot of harm to the economy and just to folks in general. So I'll stop there, but welcome to take on any questions.
All right. Thank you, Jeff. I appreciate that. So now we have, again, as I mentioned, Ruth and I are not related, but who knows? Maybe we are. Ruth, thank you for joining us here from Cobalt. Ruth, can you just introduce yourself a little bit and then just dive in briefly on some intro items as to how you've operated with COVID-19?
Sure. Sorry for the technical difficulties, and hopefully you can hear me okay. I am the HR director at Cobalt here in Arlington. I've been with Cobalt for about 7 years. I've been in HR forever. We did not shut down when COVID hit. We actually continued to work because we are a manufacturer. We make military and defense parts, and so we were essential. We gave employees the option to take a layoff if they were uncomfortable in working, and we had a few people take that option. We went into a shared work situation so that we could limit the number of employees on the floor and create a better social distancing. We worked hard to acquire masks and PPP. I actually had a friend make masks because masks were not available in March and April. And we have done, I believe, a very good job of keeping people safe. We have had very few incidents of employees actually having COVID. And when they did get it, we went through the protocol to make sure that everyone else was safe and secure and tested and such. When the vaccine became available, we worked very hard to encourage people to get it. We are not mandating our employees to get it. We are encouraging them. I would help them with getting an appointment and getting them set up to get the shot and work with them. We have currently 120 employees and we have 65% vaccinated. So what else can I tell you?
All right, thank you very much. I think one of the key things here is that connection between your workforce, the work that you all are doing in your respective industries, and the fact that that trickles down for Snohomish County on multiple levels. I had a conversation with another industry in the county, and they had a heartfelt conversation with me about loss of life in their organization due to COVID. And this is one of the things that if we sift through all of the political rhetoric that's there, and we sift through the differing viewpoints, at the base level is that basic human neighborly feeling that we all have as Snohomish County citizens and residents. And that goal is for all of us to have the opportunity to go home and be safe, right? But for all of us to flourish economically as well. And so the work that you all are doing is important to make sure that we are staying open, as Jeff said, to make sure that we are doing the right things. And so this push is very important that we make sure that people realize that vaccination rate, it should increase, and that we can be one of the forward-thinking counties in that respect for our businesses. And this is not about our government agencies. It's about people, and it's about those employers that you all have coming to your facilities, and the product that you make and create, or the impact that you have on these small businesses. So with that being said, as I step down from the soapbox, I'd like to ask you all some basic questions. And then also those of you who are on the chat, please feel free to chime in with questions. We really want to make sure that this is a robust conversation. So I'm going to start with Ruth because she finished last. I want to know what you're hearing right now about navigating COVID-19, just in general in your respective industries. Are you looking at best practices right now? Are you starting to think ahead? As Jeff mentioned, some of the variants that are coming through. What sense of normalcy are you attempting to maintain, Ruth?
Oh, we all look forward to when we can be normal again, and I don't know when that's going to happen. I have developed a good relationship with a contact at Snohomish Health Department. And so he and I touch base and we talk about when I have a case and what we're doing. He's come out and walked through the building with me. So he believes that we are completely on track in how we're doing it. We work to stagger our shift starts, stagger our break times, stagger our lunch times so that we limit close contact as much as possible. We're in a very large building, so people are socially distanced, just typically based on the machinery that they're working on, but we just work to kind of keep that as best we can. truly, it's just we continue just to watch the news and learn. And with Biden's information that came out, now we're kind of like, we're not going to mandate a vaccine, but we just need to touch base with people to say, if you now want to get a vaccine, I'll help you get the appointment and get it set up. Otherwise, you and I are going to become real good friends if I have to test you once a week. But I'm hoping you won't have to go there.
Thank you, Ruth. Jeff, any thoughts?
No, just pretty much, I know our manufacturers, they can at least allow for that social distancing, which is good, a lot of space. We are requiring masks. I think even before we did have if you were vaxxed, you didn't have to wear a mask. And then now, of course, the county says you have to be masked up. And that's what we want all our employees, no matter where they work, to be masked, at least to protect our clients and to protect themselves also. The mask thing, do I like it? No, but it gives me a slight more sense of protection. I think I've got some good immunity and, from the vaccination and previous illness, but it's not that much of a hassle for me, and, I'm willing to do it. We had gone back to work in a hybrid model, and then now they pulled us back a little bit. So that's about all I can comment on that.
All right, Bill, you have the last word here on this, and then I see there's quite a few questions coming in now, which is great. So go ahead, Bill.
Yeah, and again, thinking about this both as the employer and then in the healthcare space, we have not done a mask mandate. What we have done is, for the people who have returned to campus, you have the opportunity to demonstrate that you're fully vaccinated. And if you are fully vaccinated, then you can be mask free on campus. We're unlike Banner and some other places, we don't have walk-in business on our campus, at least not extensive walk-in business. So it's really us protecting us from each other, so to speak. So if you can demonstrate that you're not vaccinated, that you are vaccinated, then you can go maskless if you choose. With the Delta variant surge, I can tell you that there's a whole lot of masks happening even for people who are vaccinated. We had we had to sharpen our policy, I would say, in August, late August, because we had some people who had come back to work, had not demonstrated that they were vaccinated, and were not wearing masks. And for us, we had to sharpen that wasn't a personal choice, that was a condition of employment. So, and now, Ruth mentioned it, Biden's comments last week about vaccination status for certain entities. I can tell you that we are a government subcontractor. We do work with the government for Medicare Advantage products. We also administer the Federal Employees Program health benefits. So we are one of those organizations that will fall into the you're going to have to do it. And I can tell you that there's probably a little bit of a mixed bag. Premera is an organization that is spread across multiple states. We have a large contingent worker force in the Spokane area. And as most people know, geographically, the way people feel about the vaccine is different. We also have workers in Alaska. And as a company, we're going to need to be in this situation of following the rule that will mandate us to be 100% vaccinated. So we're trying to figure out how that slippery slope goes, just because there will be people that will be vehemently opposed to that. And what we had been doing so far was try to say, what's the safest environment we can create and respect that people have different opinions. Now I don't think we're going to have that option. I think we're going to need to make it 100% mandated because of the business partnership we have with the government, and that will be that. As it pertains to some of the clients that we work with, and we have at Premera, we sell individual policies, we sell Medicare policies, we sell small group policies that have been mentioned several times. We also sell to large organizations. Amazon, Microsoft, Alaska Air are all clients of Premera. And it's been a little bit across the board. as you might imagine, how those large entities are thinking about this. Some are saying it's going to be 100% mandated. In fact, one company is even mandating it for their telecommute workers. So that's you start thinking about the gradations of vaccination status, and you start saying, well, you're never going to come into one of our offices, but I still need you to be vaccinated as a condition of employment. That's a pretty steep step. And so there is some wide variation. Some other organizations are saying, if you don't want to be vaccinated, you're going to have to be tested every week, but I'll pay for it as the employer. And others are saying, but you'll pay for it as the employee because it was your choice to not get vaccinated. So we're seeing that kind of variation happen out there in the market too.
Wow. Well, thank you, Bill. I see we have some comments and questions in the chat, so I'll sift through a few of these really quickly to get us up to date. It looks like Karen mentioned the Alzheimer's Association and their mandated vaccinations to help curtail, also curtail in-person activity there. And then there was a question, I think, Bill, directed toward you. Obviously, what do we anticipate in increased premiums to employers and employees due to the pandemic?
Yeah, that's a great question. We like to say in the business that there's an art and a science to underwriting. There's actual, take the experience of claims and then apply trends and that sort of thing to it, which is the science part. And then the art part is, what do you think is going to happen? We like to have a heck of a lot more science go into the rate making than art. And what I can tell you right now is that dynamic is just almost completely unpredictable. We were looking at some information yesterday, and in a normal year for Premera, I'll use some examples just for color. In a normal year, we would count on, let's say, a trend of 5%. And that what we would see play out is plus or minus 1 point off of the 5%, maybe 2 points. So let's say between 3 and 7, 3 in a really tight year and 7 in kind of a year that went a little south on you. What we're seeing now is negative 22 to plus 44. So a 60-point swing. And that makes it just super hard to try and anticipate what you think is going to happen next. And if you look back at 2020, there were periods of 2020 where there was practically no utilization except for ICUs and hospitals, maternity, ER, that kind of stuff. A lot of behavioral health and substance abuse too, by the way. But really a drop in utilization and then a huge rebound coming back. So those kinds of swings make it really hard to predict what's going to happen on the premium side. We're doing our best. We also understand that companies are taxed and trying to keep their doors open, trying to get beyond this, and trying to not be so hyper conservative that you injure your customers. So we're trying to be thoughtful about that in a dynamic that we have just never seen before.
Wow. Thank you, Bill. Those are great thoughts and a great question as well. So Jeff, you also have a question here, a direct question. Are you seeing a steady increase of defaults and store closures, especially for small businesses?
Yeah, I can just say in general, the impact was lower than we first thought it would be. And I'm just, I listened to our earnings calls and shareholder analyst questions. So what I'm telling you right now is publicly available information. At the onset, we immediately grabbed together a team. We had identified high-risk industries such as hospitality, hotels, restaurants, educational facilities, all the immediate things that you would immediately come to mind that these are going to be impacted. And then as time moved on, we said, hey, actually, there's a couple more trickle downs than we thought. This company that supplied that company, now that, they're at risk a little bit. But we did a pretty in-depth analysis. The first thing we did was gave a 3-month no questions asked payment deferral. And that allowed folks just to not worry about that end of it. And we don't care if they were medical professionals, fair number of dentists, you know, the dental practices were completely shut down. Okay, you get 3 months, no payments. And then what kicked in was the various government programs, the PPP program, which we've all heard about, PPP-1 and then PPP-2. And that was added a lot of stimulus and kept a lot of companies afloat. And, you know, as far as I know, our loss experience was nowhere near what we thought it would be initially. Now this, I'm talking on the commercial side. I don't know as much on the residential side, but nothing that I've seen publicly on that. So, you know, thankful for the stimulus. There's also been the Restaurant Revitalization Fund that has pumped a lot of money into that specific industry. There's been the Venue Fund that's helped them. There's been the EIDL, which is a low rate loan, 1% for a number of years, that have helped a number of people and businesses. That the issue is, you know, all this stimulus, you know, we'll talk about we got to pay for it eventually, but a lot of these programs are sort of bogged down, like the EIDL program. The initial limit was 150,000, now up to 500,000. We've had people approved for the 500, but the money has not come in yet. So there's still some delays in that. We're all through the Restaurant Revitalization Fund. The initial bucket has been used up, but that was really beneficial to a lot of clients. You know, I wish it would have been a little bit less per client. You know, you could go up to 10 million on that. I wish it would have been a little less and spread out a little bit more, because some clients didn't get it. So thankfully, you know, we feel that, you know, based on our underwriting going into this kind of thing, and we plan for, you know, we haven't had a recession in a number of years. You always plan for down cycles, right? In good times, you know, we knew it couldn't get any better as far as credit quality went pre-COVID. So I think that helped us. And, you know, the banks in general have stood the test pretty well, I think, from what I read industry-wide. So.
Thanks, Jeff. Another comment we had, I want to make sure that I just highlight this for the chat. This will be shared actually on this Zoom conversation that we're having will be shared on our social media, on our Facebook page, and obviously other pages, but this is probably the first time that we've shared it directly on the Facebook page. And
Looks like Gary froze there.
While Gary's frozen, how about you each answer things that you've put into place during COVID that you think will stick around? Do you want to start, Bill?
Sure. Yeah. So I mentioned earlier that prior to COVID, about 30% of our workforce was telecommute. We went through a complete workforce reassessment, and post-pandemic, well, I don't know when post-pandemic is, but let's say after the onset of COVID, in our return to work, 70% of our workforce will be permanent telecommute. So, and of the 20 or 30% that is returning to campus, 25% are hybrid, meaning we try to do Tuesday, Wednesday, Thursday. And on those days, those are our strategy days, the in-person meeting days that really benefit from people being together. Mondays, Fridays are generally work from home for the entire company, except for the people that need to run the systems. So that is a completely different thing for us. And of course, that changes all sorts of planning for you know, our facilities and the needs there related to that. And also, you know, thinking about it from the executive level, how you maintain your people culture and your brand, your team. You know, for me, I've been with Premera 18 years. There's a lot of people that I know, and I feel fortunate about that. It's harder, I think, to imagine coming to work for a company and trying to find a way to fit in when you've never even met your teammates in person. So I just think about what that's going to mean, and that's not unique to Premera. I think all of us are dealing with that. What that will mean for the generation of people that are changing into new jobs or just getting into the workforce for the first time and not really having the benefit of what most of us had in terms of being able to work, live with people in an office space. So trying to be as safe as we can. We're also trying to be as prudent as we can with the expenses. If we can get our work done remotely and take some of the expense of our facilities off the price of our products, we're going to do that.
Katie, has everyone answered that question already?
Well, I guess we really haven't done a lot since we're still working other than change our shift starts and break times. And I think we like that. It helps with the flow of people. So I think that's probably what we're going to continue to do. So.
All right, and Jeff, it looks like you may have, oh, there you go.
Yeah, just on this one, much like Premera, those that can work from home permanently, I think the company would like to see that. And in a lot of our disciplines, it will reduce our overhead costs, which, is always a good thing. And we have a lot of flexibility at the local level. We were back to the office there for a brief period of time. We said, hey, hybrid is fine, and it could be set by the local managers. And we set Wednesday as the day that our team would all be in the office for that face-to-face, for those meetings and just the smiles and just the banter. And you could tell when we did get together, people liked it. We enjoyed seeing each other because it had been so long. Now we pulled back a little bit, but I think that human element is important. And also too, I think that, on the mental health side of it, and Bill touched on that, behavioral health, the company has really put forward a lot of extra initiatives to help and support for employees. And I'm really pleased that they did that. So just recognizing, hey, working from home isn't the easiest thing in the world. One downside is you can't ever leave work, right? You can't leave it behind. So, so some things, hybrid, I think that's going to continue. It's going to be good. And then just, the use of technology. We found a lot of clients, they don't have time for face-to-face meetings. A Zoom call is very efficient for them, and they're dealing with the same thing. So I think that's going to continue as well. So.
Thank you all. So there's a quick question about sick leave. How has sick leave changed with regards to having to have the 14 days before being cleared to come back to work? Any thoughts there from any of you?
Well, what I could offer is, we basically, like I said, we went 100% almost remote leading into the pandemic. So for us, it's not a matter of sick leave, it's a matter of location, unless you truly are too sick to work, right? If you're too sick to work, then the sick leave is what it is. If you need to quarantine, but you're not necessarily sick, we have a lot of people who are just doing that from a remote location.
For us, it's truly, if they're out, they're out. And so it's sick leave. So it's really, if they get a positive test, they're obviously out. And if they're sick, we ask that they stay home. We check temperatures with people. So if they have a fever, we ask them to stay home. We were joking that maybe we need to start giving thermometers to employees because it's amazing the number of employees that don't have a thermometer. So.
All right, Jeff, did you want to add anything to this?
Don't really have much to add on that one, Gary.
Okay. Quick question for you all, and I guess we'll start with whoever wants to chime in on this one. But as far as the business community, and as it focuses on trying to beat COVID and to get back to normalcy, where do you all see the business community being able to help and support this effort in general? What do you think are some key opportunities for us to collaborate as a business community? Any thoughts?
Go ahead, Ruth.
Yeah. I don't know. I think, we all need to work together. So if we need to mask, we mask. And if we need distance, we distance. And we just all need to work together. And we need to be respectful of each other. And remember that this is not by anyone's choice and that we all need to work together to get through it. So I guess that's what I would say.
And I know, small businesses, we miss them when they close, right? A lot of them. And we say, boy, I remember, that was a great place. And just, working near, on Colby, we've had a couple of, restaurants go out. My favorite bakery right down the street. And it's sad because I got to know these people over the years. So, I wanted to support them. And, they want to, continue to make their livelihood as best they can. So it is, they were making sacrifices. I know it's been just really, really hard to find employees. And I think that is through a lot of industries, not just restaurants, but it's, in banking and everything. I think, Gary, you probably know this, but the turnover rate on employees is just like super high now, number of people changing jobs. And that causes a lot of upset just for small business. So aside from, I hear more issues with employment issues, finding good employees than really COVID issues right now. So
I agree.
Bill, you want to add to that?
Yeah, for me, and I appreciate and agree with Jeff's comments. I think about small business in particular, and we all know people who have been in small businesses and they have just, they've had to make really tough choices. Do I stay closed? Do I open limited services? What do I do with my staff? And in our case, do we keep offering benefits when we don't have the revenue coming in the door to cover for that? So, those are just horrific kinds of choices to have to be put in front of people. So, and then I balance that, so you have companies that have been around 15, 18, 20 years, people have poured their life into their small business and they're faced with those kinds of things. And then we also have people who are 30, 40, 50 years old who have families and have died, So to me, it comes back to health and safety, because the health and safety is the answer to both of those things. To the greater degree that we can be safer as a community, then we can have more business running more fruitfully. So obviously we believe in vaccinations for everybody who's eligible to get vaccinated. We also know that we're not so Pollyanna to think that everybody that's eligible is going to get vaccinated. So please do the best you can in terms of distancing and wearing a mask. I will share with you personally that my wife is a nurse practitioner at University of Washington, and she went through all of COVID before she could get vaccinated and worked in a very tight space with a number of other nurse practitioners. And she said, the only thing I can tell you is the masks work. We were in and around the disease a lot. We were in close quarters with each other. We were masked 24/7. Nobody got sick. So to the degree, even if you can't go down the road of vaccination, please wear your mask.
Solid point there. I appreciate you all diving in on that a little deeper. Kevin brings up a very important question and basically asking, how do you remain respectful of your team members who do not want to be vaccinated, or whatever the reason they may have, and how do you remain inclusive and not marginalize them? So I'm going to push it on Jeff and then Ruth, and then we'll come back to Bill.
Oh, thanks, Gary. We always say in our office that, when we look at our clients, we're like Switzerland, okay? We're neutral. And this is, we have clients on the left and the right politically. And this happens even before, the current debate, right? It's about who's in office and policies and this and that. So we try to be as neutral as possible and, and respectful. But at the same time, I share my personal story of what I went through. And I tell people when I meet them, it's like, I did meet some people a couple of weeks ago, and I sort of put out my hand for a shake, or it was going to be a fist bump, that awkward, and we agreed, okay, we'll pass on that. And then I'll say, hey, I'm vaccinated. And then, 9 times out of 10, the people I'm meeting will say, oh, I am too. And it's not like, you should get vaccinated, but I just sort of tell my story of what I came from. I know I don't have to share it, but if it helps one person decide, hey, maybe I'll take a look at it, that's fine too.
Go ahead, Ruth.
So like I said, we don't mandate our employees to get vaccinated, but we do encourage them. And I work very hard to not make them feel bad for making that decision to not get vaccinated. I had an employee that just recently had it and has come back, and I asked if they were considering a vaccination, and they said no. And that is their choice, but they are very good at wearing their mask. And so to be respectful to each other's decisions, that's how we kind of move. And they said that they would be more than willing to get tested once a week if the Biden thing goes through. So I think it's just important that you give them the information and give them the assistance to get it if they choose to. And if they choose not to, then they need to understand what the ramifications potentially are. So.
Thank you, Bill.
Yeah, I'd echo those comments. And the only other thing I'd say is the whole idea of marginalizing. There's a whole new dynamic that we're going through when you have workers on site and workers on Teams or Zoom. There's not a meeting that I have anymore at Premera that doesn't have both a room location and a link. Mm-hmm. And it's a whole other corporate culture thing that we got, because then we fall into the trap of the 7 people in the room are having a conversation and not engaging the people who are not in the room. And so we have to learn other skills about how to work with each other across mediums, which I think is really important if you want to remain inclusive. And I think, that's a goal for all of us. And we've just been given a new hurdle to try and do that, regardless of whether the people who are on the screen are vaccinated or not. That's just another thing we got to deal with in this day and age that, I didn't think as much about 3 years ago. By the way, I had a conversation with somebody the other day. I'll just share this. Could you imagine if we had to go through this in 1995 instead of in 2020? How many businesses would not be able to say, okay, I'm going to do my work remote, even 80%, right? Just the decimation that would have happened to our economy if we didn't have the technology that we have today.
Excellent point. 1995 with the technology there. Very, very good point. I do have another question, but I think there was a comment. Bill, you answered it directly from Tracy, but in this conversation, how do we define small business? Jeff, I'm going to throw it to you, and then Ruth, throw it to you and opine however you like there.
Yeah, small business, to me means, anything up to probably, $1 million in sales or something like that. The banks like to define things. Some say 10 million or 50 million in sales. But so when I reference it, from my perspective, it's everything from, Main Street type businesses all the way up to manufacturers like a Cobalt, like suppliers to Boeing, et cetera. So those obviously are big. So I'd say, safely under $1 million or 2 million in sales is what I'm referring to.
As an HR person, I always think of small business as anything under 50, because there are a whole bunch of new rules and regs that come in when you hit that 50 mark. So that's kind of what I think of.
All right, folks, we're winding down the time here, but before we get to that point, I want to make sure that we ask all of you that are in the chat or just on Zoom. I know we have, I want to highlight the fact that I know I thought I saw Mayor Tolbert on here. So I also saw, let's see, Cameron from Tulalip Tribes, several others on here, even Angie from our Snohomish County STEM efforts, and Sarah Cho from City of Stanwood as well. Quite a few folks, Representative Larson's folks. I'm sure I've missed some other names, so I should stop mentioning folks. But I really think this is a dynamic that is really key and important for our community to move forward. So I want to ask and pose a question to those of you in the chat who are small business owners or just general business owners, or tied to organizations that support businesses. EASC is launching this Get Back to Business campaign, making sure that we can sustain the businesses that Jeff mentioned, and Ruth highlighting her organization, and Bill highlighting the large reach of businesses that they associate with as well. We would like to launch some ad campaigns to make sure that we focus on small business and large business. We want to focus on the overall business community in Snohomish County, highlighting that we're all working together to at least fight through this effort. So if you are at all interested in collaborating with us on any of our promotional efforts in this piece, or want to be a part of one of these coffee chats that highlights what you're doing with your business, we'd love for you to reach out to us there. So I've said that that little commercial piece, and now I'm going to ask that if there are no final questions from the folks in the chat, you can reach out to myself, Gary Clark. I just saw a question there. You can find me at Gary C at economicalliancesc.org. Or Katie Leone is on here, who is our communications guru, and Katie has put her email in the chat as well, and she helps us to facilitate all of these. All right, I want to make sure that each of you, if there are no further questions from the chat group, again, this will be posted on social media as well. I think us coming together is important, but Bill, Ruth, Jeff, I'd like to give you a chance to kind of give your final parting thoughts on this topic. If you want to merge that with the work that you're doing industry-wise, please do that. I'm going to start off with my potential relative, Ruth from Cobalt. So Ruth, you get to lead off, and then we'll go to Jeff and then finish with Bill.
Well, thanks for letting us speak. Cobalt is doing well and continuing to get more and more business. And so one of the things that I'm working on is truly trying to find more employees. And so if you know of people that are interested in joining manufacturing, we are a great place to work. And we have a wonderful benefit package. Encourage them to contact me directly, or just go to our website and log in and let us know. So thank you.
And my final comments are that, yeah, things have really been turned upside down in the last 18 months, and it's really accelerated the pace of change. We were in the banking and finance world, people were migrating to online things, right, at a slow pace. And then now, when your local branch is closed due to staffing or what have you, or you don't have to wait in a line, your phone now is your local branch. So I think that's really accelerated, and it's really accelerated throughout our industry, and I know a lot of industries as well. So I think it's my gut feeling that more and more people are going to realize that vaccinations, I'd rather do that than the opposite. And as we hear, I like the campaigns that are focusing on real people telling their real stories, and hopefully that will convince us to go the same way. It's the same like I'm not a medical expert, but I remember getting a polio dose in elementary school, I think it was, and everybody did it. You had to do it. And I know a fellow that had a touch of polio, and just think of how the world would be so different if we didn't have more people vaccinated. So just wish everybody the best, stay healthy, and thanks for allowing me to participate.
Yeah, those are great words, Jeff. My mother-in-law, who I just saw over the weekend, is post-polio. So she would have loved to have been able to get a shot and not spend her high school years in an iron lung. I can tell you that. So that comment hits home for me. And I do think, Gary, this is it's a personal phenomenon, right? And personal then into your family, then into your community, then into the region. We were talking a little bit before about, Idaho has such a low vaccination rate, and Idaho is now exploding to the point where their patients are coming across the border into Spokane. Spokane's patients are coming across the border, or the mountains, I should say, into Seattle. And we're seeing more and more care that has to be diverted or delayed for non-COVID related reasons, because we're filling up our ICUs with people. And we should make no mistake, I don't know what the right number is, but it's 90 plus, conservatively 90 plus, could even be higher, of the people who are in those ICUs and on ventilators are not vaccinated. Mm-hmm. Right. So that's just a reality. And if we think that that's Idaho's problem, I think we're missing it, because that impact is going to come our way as well. And Idaho, by the way, their own public health officials have suggested that on the trend they're on, in the next month, they could see 30,000 new cases of COVID per week. And we're talking about a state that has 1.8 million people in it. And not all those people are going to end up on a ventilator, for sure, thankfully. But it's going to be, it's going to drain a lots of other resources regionally, including in Western Washington, including in Snohomish County. We will feel the impact of those kinds of things. So again, we want to urge safety, health and safety, have to respect people. And if you're not going to get vaccinated, then wear your mask and limit the amount of interaction you have with people. And the last thing I would just share is, we had a conversation with the head of immunology at University of Washington, and this person said, I hate to tell you guys this, but this is here forever. This isn't let's just get through the winter, right? Especially with kind of the dynamics that Gary mentioned earlier, kind of the polarizing positions that are out there. It's going to be here for a while. We're going to have to manage through it. And so to the degree that we think we'll just wake up one day and it'll kind of be gone, that's probably just not reality. So we will be better off when we're stronger as a family, as a community, as a region, to be able to fend that off. And that will be good for our business as well as good for our health.
All right, folks, great words from each of you. Really want to thank you for taking the time to tackle and discuss very serious and timely issue. And there's more to come, as Bill mentioned. And so from the history that I know about communities, I know for sure that Bill's comments are important. We're stronger together than we are apart. And so if we can band together to tackle this, we can continue to push ourselves forward to some sense of normalcy and make sure that we are protecting our small businesses, our large businesses, and our overall community. I want to thank again, Jeff Mitchell, Ruth Clark, Bill Akers, all of you, very, very thorough in your presentation to us. And I want to thank all of you who stayed on the chat to hear this. We will be sharing it out again to our social media. Katie, our next coffee chat topic is going to be September 21st at 8:30 a.m. And it is actually untapped workforce, which highlights again a need here in Snohomish County. So again, please remember to push for those vaccinations, push for masking up if you're not, and please continue to join us in this effort. Economic Alliance Snohomish County, another coffee chats, coffee cups in the air for those of you still with us. All right, we'll see you soon. Take care.